Yes.
Dr. Leigh, sealants, dental sealants, are they really like as useful as people say, or not? And who should have them? Very young adults, adults, can they have them? Tell us all about sealants.
Sealants essentially, it's a filling that covers the grooves and the pits and the teeth that are associated with the normal anatomy. And the purpose of the sealant is to prevent, food particles from getting inside those grooves and pits, because it's very difficult to get a toothbrush in those grooves and pits to keep them clean. So generally, we place sealants on children who are in an age where maybe their sugar intake is highest. If they're compliant, if they're doing their best to keep their teeth clean, and there are those really deep grooves and pits, then we may need to assist them by placing those sealants. So we don't automatically place sealants on every child just because the molars are coming in. It really depends on their home care habits and the anatomy of the tooth and their diet. Because if you place a sealant improperly, or a child is not a good candidate for it, the sealant can break down and they can end up getting a cavity under the sealant. So it's not always a sure thing or guaranteed thing that we're not automatically placing sealants on kids. So they're very helpful, and they can be placed on adults too. But mostly it's children, and generally it's when they're 10 to 12 years old, when those molars start coming in.
I see. So it's on the second teeth that they get put on. And how long do they last usually?
Well, generally they're probably good for about 5 or 6 years. If they're coming in for their hygiene appointments, sometimes they may chip it. We can repair them very quickly right there on the spot. So again, it's a filling material, but it's a weak filling material, so it's not going to last forever. It's just to get kids through that difficult stage where, again, sugar intake is highest, which is generally preteen, teenage years. Sometimes we remove sealants when they become adults, just because they could just end up collecting food underneath, and again, we want to avoid a cavity under a sealant because it defeats the purpose.
Right, because it could potentially, after a while, have the reverse effect. Like, there it is, but it's a little tiny bit loose, not visible to the eyes. Right. Something goes in it, and now it's nicely covered in there, and it will foster even better there. And as a dentist, you see it even less. So there's that in between. So you say, like, for the teenagers, usually when it has the best effect to have it on. Well, all right. Thank you very much, Dr. Leigh.